We should then talk about what RFK Jr. is trying to do, because he just rolled out what Health and Human Services is calling a MAHA action plan to curb so-called psychiatric overprescribing. And that includes SSRIs that you've probably heard of, like Zoloft, Lexapro, and Prozac. And in his rollout statement, you had Kennedy saying that he wants to shift the standard of care toward prevention, transparency, and a more holistic approach to mental health. And he also said that this isn't about taking medication away from people who currently rely on it, but he wants to reduce what he called unnecessary dependence. And the actual plan, at least so far, does look to be pretty modest. Right? HHS will put out a report on prescribing trends, they'll roll out provider education around what they're calling inappropriate prescribing, and they'll push what they're calling non-pharmacological interventions, therapy, sleep, exercise, and diet. And here's the thing, like on its face, not really any of that is wrong. Therapy is underused in this country, sleep matters, exercise helps, most psychiatrists would tell you the same, but the problem isn't the bullet points. For many, part of the problem is what RFK keeps saying around them. Because in making his case for this, Kennedy has now multiple times, including this week, compared SSRI withdrawal to coming off of heroin, saying that a family member's experience tapering off of an SSRI was, in his telling, comparable to his own well-documented past withdrawal from heroin. And in the past, he's gone even further and claimed that antidepressants are actually harder to quit than heroin. And so, with this, I want to be thoughtful, I want to be careful, because this is a very real thing. SSRI withdrawal, it is real. People genuinely experience withdrawal symptoms when coming off of antidepressants. For some, it can be very rough. The medical community at times, I think, has underplayed how rough. That is a conversation that is worth having, but also heroin withdrawal, which can land people in the hospital, which carries one of the highest relapse rates of any substance, which has driven the worst overdose crisis in modern history, is not in the same universe. And so you have people, including experts, saying when the person setting US health policy keeps reaching for that comparison anyway, it stops being like a medical argument and it's more of a rhetorical one. Also with this, we should talk about the numbers, right? A recent survey found about 16% of adults are currently taking an antidepressant, with actually the people behind this plan pointing to that number as evidence of overuse. But there's also numbers missing from the rollout, right? Only 40% of adults and adolescents with diagnosed depression have actually received counseling or therapy at all. And depression rates in this country, according to Gallup's most recent polling, they're sitting at historic highs. And so when the people who actually treat mental illness, they look at that same data, they don't see overprescribing as the central problem. They see massive undertreatment as a massive problem. They see millions of people who can't find a therapist, can't afford one, don't live near one, or waited months for an opening and gave up. They see medication often as the only piece of mental health care that a lot of Americans can actually access. And so it ends up not being that surprising when you have the American Psychiatric Association, while welcoming, a national focus on mental health, directly objecting the framing we're seeing here, saying we strongly object to framing the nation's mental health crisis as primarily a problem of over-medicalization or over-prescribing, saying that characterization oversimplifies a complex crisis and ignores the larger reality. Too many patients cannot access timely, comprehensive care while care remains unevenly distributed across our health system, with them going on to argue that the solution is not stigmatizing psychiatric medication. The solution is making sure that patients have access to the full range of evidence-based treatments, right? And to be guided by the best available science and the patient's actual needs. And so actually, with that, we then have to flag that major medical organizations were notably absent from Kennedy's rollout. That's why you're seeing them respond from the outside. They weren't on stage, they weren't quoted in the press release. And you have some saying that Kennedy has a track record here. He's previously suggested, with no supporting evidence, a link between antidepressants and school shootings. A claim that actually mental health professionals have spent years pushing back on because it stigmatizes the people most likely to be in crisis and least likely to be violent. But with this whole situation, you can sort of see how and why some people might get skeptical about how psychiatric medication is prescribed in this country. Where you've got kids sometimes prescribed multiple medications by providers who aren't psychiatrists, long-term SSRI use, it's not always reevaluated, and withdrawal, it's not always explained clearly to patients before they start. There are very real conversations that need to be had about how prescribing happens and who's doing it. But that's largely a conversation for clinicians and patients, right? Not a federal action plan built on the framing that an entire class of medication is the problem. Right? Because the larger mental health crisis in this country, the rising depression rates, the loneliness, the suicide numbers, the kids in waiting rooms in towns that don't have a therapist, that crisis is about access. And also, of course, cost, right? We have a healthcare system where the cheapest mental health intervention is a 15-minute appointment and a prescription. Because among other things, the alternative, actually ongoing therapy, is something that most insurance still won't fully cover. And it's why you're seeing so many people saying, hey, the energy's right, the thinking of helping people is right, but telling people that their medication's basically heroin doesn't get them therapy. It just gets them scared. But hey, and I'm finding myself saying this multiple times today because I'm actually very interested in your thoughts. What are your thoughts with this story, especially if you're on or have been on this medication in the past?